F in number 1. I have a lump behind my knee. What is that? That is a Baker's cyst in your knee. When you have the top of the knee, the thigh bone, and the bottom of the knee, the leg bone, particularly the tibia, which bears the weight of the leg. The fibula is a little bone on the lateral portion of the leg. They come down together. That is your knee joint. Your knee joint goes back and forth and back and forth. Well, around the knee is a balloon encapsulation. That capsule is full of a fluid called synovial fluid, synovial, that serves as a lubricant so that as your joints move, they don't generate heat, they don't grind each other into a sense of just grind themselves away, just damage the joint by grinding. So that lubricant is kind of the same as oil in a car engine. So you have that benefit. And so when you do it, the problem is that balloon, imagine this. I have a round balloon on my desk and I'm going to pick it up. So I take my 2 hands, I bring them together, I lift up the balloon, I'm holding the balloon in my hand. Okay? Visualize the balloon in my hand, a round balloon. Well, now I take my 2 fists, I pick up the balloon, I put it like this. The balloon is between my 2 fists. And as I bring my fists together, the balloon wraps around each one. Visualize that the balloon wraps around each part of my hand. Well, that is exactly what happens in the knee. The thigh bone and the knee bone like this, the balloon wraps around. If for whatever reason the balloon gets a bulge in it, and it comes out, the path of least resistance is to go to the back of the knee. That is called a Baker's cyst. Sometimes the lump will go back in and it's not a problem. Other times it twists on itself and now you got a sack full of fluid that's continuously manufactured. The lining manufactures the fluid. So now it can grow. It can become a space occupying lesion and can cause pain. So primary therapy for that is just sticking a needle in it and draining it. So I will do that up to 3 times. But the body has an amazing ability to heal itself. When that happens and it heals itself, then you have to go in and take the balloon out, or at least a portion of the balloon. So that is a little more intensive surgical procedure that I used to do, but I don't do anymore in the office because you have to, quote, have a surgical center. So when that happens, you have to have that removed. And you also want to have it repaired in a way that you still have the protective fluid surrounding the joint so the joint does not grind itself into a dry, like rubbing your knuckles together with sand between them. So you don't want that to happen. You want to do that. So that's what you have. That's what that knee is, a Baker's, Baker' cyst. Google that and you can see some nice pictures of it. Okay, great question.